Hi everyone, welcome back to my YouTube channel. In today's video, I will be talking about the quality measures that are in the Home Health Quality Reporting Program. Let's get started. The following three categories of quality measures are used in the Home Health Quality Reporting Program. First is outcome measures, second is process measures, and third is patient-reported outcome measures. Outcome measures. Outcome measures assess the results of healthcare that are experienced by patients. The data for the home health outcome measures are derived from two sources. First, data collected in the Outcome and Assessment Information Set or OASIS submitted by home health agencies. And the other one is data submitted in Medicare claims. Measures based on OASIS data are calculated using a completed episode of care that begins with admission to a home health agency or a resumption of care following an inpatient facility stay and ends with discharge, transfer to inpatient facility, or in some cases, death. Measures based on home health claims data are calculated based on the first home health claim that starts an episode of care for a patient and ends either 30 or 60 days after the initial claim, across an entire episode of care, or during the period of time following discharge. Many home health outcome measures are risk adjusted. The risk adjustment methodology, using a predictive model developed specifically for each measure, compensates for differences in the patient population served by different home health agencies. The Home Health Quality Reporting Program measures and the broader list in the Home Health Quality Initiative include four types of outcome measures. First is improvement measures, that is, measures describing a patient's ability to get around, perform activities of daily living, and general health. Second, measures of potentially avoidable events, that is, markers for potential problems in care. Third, utilization of care measures, that is, measures describing how often patients access other healthcare resources either while home healthcare is in progress or after home healthcare is completed. And fourth is cost/resource measures. For a list of home health outcome measures, please visit the web page that you can see on this slide. I have also included this link in the description box down below. Now let's talk about process measures. Process measures evaluate the rate of home health agency use of specific evidence-based processes of care. The home health process measures focus on high risk, high volume, problem-prone areas for home health care. These include measures pertaining to all or most home care patients, such as timeliness of home care admissions. Process measures are derived from data collected in the OASIS submitted by home health agencies and are calculated using a completed quality episode that begins with admission to a home health agency or a resumption of care following an inpatient facility stay and ends with discharge, transfer to inpatient facility, or sometimes death. Unlike the outcome measures, process measures are not risk adjusted. Risk adjustment is not considered to be necessary for process measures because the processes being measured are appropriate for all patients included in the denominator. Patients for whom the measure is not appropriate are excluded. The home health process measures include the following: timely initiation of care, percent of patients with an admission and discharge, functional assessment, and a care plan that addresses function. The other home health process measures are drug education on all medications provided to patient/caregiver during all episodes of care, influenza immunization received for current flu seasons, influenza immunization offered and refused for current flu season, influenza immunization contraindicated, drug regimen review conducted with follow-up for identified issues, transfer of health information to the patient, transfer of health information to the provider. Patient-reported outcome measures. The home health CAHPS measures, for those who do not know what CAHPS stands for, CAHPS stands for the Consumer Assessment of Healthcare Providers and Systems. The home health CAHPS measures are derived from a 34-question survey. The survey collects feedback from current or recently discharged home health agency patients or their family or friends about their experiences with a home health agency. The survey is the first national standard for collecting information on home health agency patient experiences that allows for valid comparisons between home health agencies. The survey has a core set of questions. The survey allows home health agencies to add their own customized questions to the survey to support internal customer service and quality related activities. CMS groups the home health CAHPS measures by topic into 3 composite measures and 2 overall measures. CMS publicly reports the home health CAHPS measures and they are called patient survey results on the Care Compare website. The 5 measure areas are care of patients, communications between providers and patients, specific care issues, overall rating of care, and patient willingness to recommend home health agency to family and friends. For more information on the home health CAHPS measures and the home health CAHPS survey, please visit the website that you can see on this slide. I have also included the link to this website in the description box down below. Claims-based measures. These measures are a subset of home health outcome measures. CMS calculates them using Medicare fee-for-service claims data. There are 2 types of claims-based measures. First, claims-based utilization measures, and the other one is claims-based cost/resource use measures. Claims-based utilization measures. These measures provide information related to the use of healthcare services, example hospitals, emergency departments, etc., resulting from a change in patient health status. They are calculated using the first home health claim starts an episode of care for a patient and as appropriate the claim for the period after discharge. Negative events like potentially avoidable hospitalizations or emergency department care or a lack of such negative events. These measures use healthcare utilization data to indicate whether patients achieved a successful outcome of care, example, discharge to community, or instead whether they have unresolved care needs. In most cases, lower values are better than higher values because they show fewer adverse outcomes for patients after receiving home health care. These are the 5 claims-based utilization measures. First, acute care hospitalization during the first 60 days of home health. Second, emergency department use without hospitalization during the first 60 days of home health. Third, discharge to community. Fourth, potentially preventable 30-day post-discharge readmission. Fifth, home health within stay, potentially preventable hospitalization. The other category of claims-based measure is cost/resource use measure. The Home Health Quality Reporting Program also includes one measure of cost/resource use. Medicare spending per beneficiary, post-acute care, home health. This measure assesses the Medicare spending of a home health agency compared to the average Medicare spending of home health agencies nationally for the same performance period. This is it for today. I appreciate your time and interest. If you like this video, please consider subscribing to my channel. Thank you for joining me. Bye now.